I'm Karen. I'm going to talk to you today about how hypnotherapy can help with chronic or persistent pain. Medically speaking, chronic or persistent pain is a pain that somebody's had for over 3 months. Now, it's often a very difficult thing for people to deal with chronic pain because it's very confusing, doesn't follow a pattern, and it's difficult for themselves, their family, and people that love them. So with chronic pain, really, to some degree or another, the nervous system is involved in that process. And it can be that things that we do, think and feel affect how the nervous system responds, and in line with the amount of pain that it produces. So hypnotherapy can be really helpful in managing some of those aspects I've just talked about. I just want to talk about a client that I've seen recently. He's a 42-year-old gentleman who's had persistent pain for over 10 years. He came to me really because he tried all conventional treatments, including operations and medication, and none of which really had helped him to any great degree. And in fact, he was worried that things were going to get worse. He described a pattern of struggling at work, not having a good relationship with his wife, finding it difficult to integrate with his family. What we did, first of all, was talk about why he might be experiencing the chronic pain, what he could do initially that would help, and part of that was doing relaxation and the hypnosis. And he took to doing self-hypnosis really well, doing it twice a day, in fact. And then we talked about how he could think differently about the pain, make small goals about how things could be different, even if he had the pain, really. And then look at making gradual goals each week that he could work towards, which were achievable for him. At the end of 13 sessions, he found really gladly that he was able to manage work a bit better. He changed his shifts to fit in a bit more of what he needed for his pain problem. He was able to communicate more effectively with his wife, and he'd started going to folk group again and taken up playing the violin, which he hadn't done for many years. And he was starting to enjoy being with his family again. In fact, I think it's fair to say that he was actually starting to enjoy life again. We didn't actually talk much about the pain in the sessions, but I asked him at the end whether he had had any pain relief through the hypnosis. And he explained that, yes, to some degree, he did get some windows of complete time without pain, and obviously that's great. But most of the time he noticed that the pain was just reduced, but it didn't have the impact on his life that it had done prior to therapy. So by taking small steps, using the hypnosis, understanding what helps and what doesn't help with pain, he got control back of his life. So if you're interested in finding out a little bit more, then just contact me and I'll be happy to see you.